Good evening, everyone. I welcome you to the speech hour today. And our title for today's speech hour is Hearing Loss and Speech and Language Development. I am Pratiksha Gupta. I am the founder and director of One Special Place, which is India's first online speech therapy platform. And we are helping hundreds of families all across the world through our services and our products. With us today, we have a very eminent personality. It is Dr. Rajalakshmi, ma'am. And I have been conversing with her for the past 15 minutes, talking about our journey and how better we can make our services. I welcome you, ma'am, to the show.
Thank you, Pratiksha. Good evening, everyone.
So nice. Before we really start talking about today's items under hearing loss and speech development, I would like to introduce Raj Lakshmi ma'am to everybody, to all the listeners and viewers. Um, Raj Lakshmi ma'am is currently serving as a senior professor of audiology at All India Institute of Speech and Hearing in Mysore in India. She's a very humble person, and if you have been her student, you would know that she's so approachable, and she's so lovely always. And underneath that, she's a very powerful clinician as well, and a great teacher. And she's one of the finest personalities that audiologists, look up to. She's armed with more than 35 years of clinical and research experience. She has also served as a former director of Department of Audiology at AISH in Mysore. She has a variety of researches, both national and international, under her belt. Her main, her research interests revolve around speech perception, hearing loss, hearing aids, cochlear dead regions, auditory rehabilitation, and many more. She also has written a book called on Music and Hearing, which Anne has co-edited various books for public education. She even has her own website, and which has details about her research. And I think it's just a very brief introduction about ma'am. There's so much more that has gone into those 35 years. And I think we are very lucky to have you, ma'am, among with us today, so that we can learn from your experiences, from your work, from your engagement with patients and families that you have on a daily basis. Okay. Anything that you would like to share with us about your journey, ma'am, before we start on with our questions and ideas? Anything that you would like to share with us?
Yeah.
I think, ma'am, can you hear me?
Hello.
Hello, ma'am, can you hear me? There seems to be some technical issue. Ma'am, you can refresh your screen if you like. Okay, I think we lost ma'am for a minute there. I'm sure she'll be joining us soon. Until then, our viewers, I request you to please stay with us. You can drop in your comments and your questions in the comment section below, and I'm sure ma'am would join us soon, and we would be happy to answer your queries. Ma'am has just dropped me a message saying she's refreshing her system and we should be able to join us shortly. I'd like to tell you that we have already pasted an album on our Facebook page which talks about the agenda points for today. And we have ma'am with us. I'm just going to add her again and start the conversation. Okay,
Yeah.
so we are back.
Yeah.
All right. Okay. So, ma'am, I shared a bit about your experience. So, I just wanted to know if there's anything that you would like to share with us regarding your long journey in the field of speech and hearing and audiology. Is there
Yeah.
anything that you would like to share with our listeners, our viewers?
Yeah. Thank you, Pratiksha, for a very nice introduction. So, I started my journey in the year 1979,
Wow.
enrolled as enrolled as a student at Aish, and completed my post graduation in '84. And then I took up a research project, and served as a research assistant for 2 years. And then I started with my research. So, over these decades, I have seen tremendous improvement in terms of the technology for identification, rehabilitation, and empowering the parents. So, I think if you look at the 80s, we used to only see the body level hearing aids, pocket type of hearing
Yes.
aids.
Yes.
So I think
Yes.
whenever I used to meet my students who come from abroad, they would also say in the 90s that still we are using body level hearing aids, and which had become obsolete in those countries. So thanks to the technology, even in India now, many children can have the dream of having very advanced technological hearing aids, to the extent that cochlear implants have become so
Yes.
common. Yeah, like the governments have schemes, the Ministry of Health and Family Welfare, and
Mm.
also Ministry of Social Justice and Empowerment are doing two different programs where they are serving cochlear implants also as one of the intervention techniques for hearing impaired. So I think that would have been like many of our dreams have come true.
Yes.
Because whenever you
Yes.
see our students who are working abroad, they would talk of so much about AVT,
Mm.
about cochlear
Mm.
implantation, multimodal stimulation. I think we
Mm.
were lagging behind in those. But now, thanks to the governments, the technology, and the institutions and the professionals who have been made many of the hearing impaired's dreams come true. And
Mm.
there are so many success stories. So if you look at all those kids who have become adults now, you feel so
Mm.
happy. And so
Yes.
many of them have achieved so much. You feel, oh, this is some feather in the crown for the
Yes.
people from the family and the professional group. Yeah.
Yes. 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 No, it's so wonderful to have a veteran like you join us, and I'm sure we have so many
I'm
questions. And
honored being
no,
on this
no,
platform because this is something novel that our students do. So I always take pride when my student does something much better than me. So it's
right,
a
right.
it's an honor to the teacher.
Yes, yes. No, no, that's great. That's great. And I'm sure, all our viewers are really interested in learning a lot more from you.
Yeah.
So, ma'am, getting back to learning a little more about hearing loss and how it is identified. So, can you share some ideas about what exactly? So, say a layperson is watching this video. So, what exactly is hearing loss when we say, and how can somebody identify hearing problems?
Yeah. So I think this might interest me to say there are a lot of causes of hearing loss. So it can be detected even before the child is born. So there is a story of Abhimanyu listening to his mother. So I think
Yes,
that talks about the fetal testing. So
yes,
Abhimanyu was the example for hearing the mother and the maternal uncle while he was in the fetus. So there were responses from him. So that is one important point that I have to make, saying that it is possible to know about the baby's hearing while the baby is in the womb. So there are different techniques to know about how the fetus is capable of hearing. And then once the child is born, there are different ways. Like the causes could be like prenatal, perinatal, and postnatal.
postnatal.
So if you think of those causes, then there are a lot of checklists which are developed. So these checklists can be administered, and these are called as high risk registers. So
Yes.
lot of these high risk registers can be administered to the young mother after the
Mm.
child is born and try to know what are the risks the baby had. So it could be something like hyperbilirubinemia, or
Yes.
the mother had lot of problems in the first trimester, and she had some infections which can all be detected, and that could be related to the hearing loss. And then there are some conditions which are important at the time of birth. What is the kind of delivery, and whether the child breathed properly immediately after birth, did the child cry immediately after birth, and was the oxygen available to the baby. All such conditions determine whether the child is going to develop normally in terms of hearing and speech and language. So, knowing such information, the risk factors, can help us in identification of the hearing loss. So, we have to think of the high risk registers. So, the high risk
Mm.
registers are also there for babies between 0 to 28 days,
Okay.
and from 28 days to 1 year, and later also, because the causes of hearing loss could be congenital, genetic,
Yes.
and acquired. So based on that, you can make checklists and administer and get some idea about what is the risk factor, and then uh, do the further evaluations. So the next would be the tests that we think of. The tests can be in terms of screening. In most of the Western countries, especially in America, there is a joint committee on hearing screening. So
Yes.
it is called as JCIH. So it has recommendations for all the newborn infants. So once the baby is born, the baby has to be screened for its hearing. So there are tests called as otoacoustic emissions and auditory brainstem responses. So
Answers.
these have to be
Mm.
conducted on every live birth. So if the children pass that screening, it means they are going to develop normally in terms of speech and language. If they get referred on one of these tests, it becomes mandatory that their auditory behavior and its development is to be thoroughly followed on. So if you see that some child is referred on the OAE, it becomes necessary that ABR has to be done, auditory
Done.
brain response. So once you see that the child has passed both the screening, then you can leave the child to develop normally on the auditory behavior. If it is found that there is a referral, then it becomes very important and imperative that the child has to be followed up at regular intervals to make sure that the child is developing normally. So these are very important screening tools which can tell us about the hearing of the baby. So there are different types of screening and tests that can be done. So it starts with the ABR and OEE. Then you can go in for play audiometry. You can go in for visual reinforcement audiometry. Then you can go for pure tone audiometry. Pure tone audiometry is a very important gold standard for determining the hearing status.
Yeah.
So it involves the patient's or the child's active involvement. Whenever the sound is presented, the child has to respond. So that would be a very important tool.
Right.
Then
Yes.
there are a lot of ways of detecting hearing loss. So it can be starting from the mother, the immediate family environment, school, teachers, then the audiologist, and many of the time it is the GP and pediatrician who can refer the child to the audiologist. So there are different ways of detecting the hearing loss.
Hearing loss.
And when we consider the incidence of hearing loss in India, it's about 6 to 16%. That's what is reported. And
Okay.
very important variable here would be like if children have minimal or mild hearing losses, or if they have one side unilateral hearing losses, that might go unnoticed. So this
Yes.
statistics may not involve those kids who have
Final.
mild problem or unilateral hearing loss.
Yes. Hmm. Right. So, ma'am, that was great information, and I'm sure the parents who are watching this would really relate to it.
Yeah.
When it comes to identifying hearing loss,
Mm.
obviously there are children who also develop auditory processing problems, and CAPD,
Yeah.
as we say, central auditory processing disorders.
Yeah.
And ma'am, according to your experience, when we talk about auditory processing disorders and similar conditions, at what age usually those symptoms are seen, and at what age can they be identified when a child has a auditory processing disorder?
Yeah. I think important point to be noticed here is the middle ear condition. So there is a
Okay.
condition called acute otitis media.
That is median. Yes,
Yeah,
yes,
it
ma'am.
is one of the biggest culprit for auditory processing disorders in young children, because there is some ear infection, and that ear infection, if it goes unnoticed and untreated, it can lead to processing problems.
This
So the auditory processing is behavior, or say our response to sound, has a hierarchy, because there are certain things that we do as very young children, and there are certain things which needs some maturation. So auditory processing has a maturational hierarchy, because there are some things that we can say, yes, I know, I detect this. There are certain things that need to say that I identify this, I can comprehend this, I can
right.
separate this, because you have 2 years, and the 2 years have a very big role, because it fuses the auditory information, it makes the auditory information from both the ears could be separated. So our task has to be like whether we can fuse them, we can integrate them, we can have processes of closure, we can have processes of temporal domain, whether we can have processes of spectral domain, the pattern recognitions, all such things go on a hierarchy. So maybe it is when you consider two sounds, one with a low frequency and the other one with a high frequency, you can distinguish between them. You can say one has a low frequency, the other one has a high frequency. But when you have to order them, it requires some task. So it can come in any combination. That's called as a pitch pattern, the pattern perception. So you can order low, high, high, or high, low, low, or low, low, high. So it goes on a hierarchy. So this will be the first thing the child could do. But there are certain other complex tasks which are on the temporal domain. Say, to say that is there a small silence between two acoustic events? So that's known as gap detection. So that requires the auditory system to have reached a certain maturity. So most of the
Yes.
temporal resolutions are the ones which mature the last. So by 11 years, most of our spectral as well as temporal processings have matured, have reached the adult stage. So by 11 years, you would be able to say whether the child is
Tyler.
having auditory processing disorders
Okay.
or not.
Okay. Because, ma'am, we see a lot of children who have autism spectrum disorders, or,
Yeah,
those who have final language delays and
yeah,
specific language impairments. So sometimes, as therapists, we do tend to question whether the child has an auditory processing disorder or does not have. So
yeah.
when it comes to actually identifying and pinpointing, so do we have tests, objective tests that we can use?
Yes, of course.
Um,
Yeah,
yes.
there are a lot of
So
behavioral and objective tests. So, like most of the behavioral tests are based on dichotic performances and
yes,
then
yes,
temporal resolutions. Maybe you can do dichotic digit, dichotic rhyme, and
yes,
move on to the temporal resolution, which will be TMTF, gap detection, and then
yes,
temporal ordering, pattern,
yes,
all such things. And most important for these children would be the speech in noise,
yes,
noise
yes. The
performance,
spin.
because
Yes, yes,
they tend to have normal audiometric pattern. Like when it comes to the thresholds, their thresholds might remain in the normal auditory acuity range. But when it
right.
comes to performing tasks of higher order, they would not be able to perform it. Like, for example, the speech in noise is one very good gold standard test, which will be affected in them. Whenever there is noise in the environment, their speech will not be perceived as good as normal.
Yes,
That's the
yes,
indication. So when you do
yes.
spin, you know. And then there are a lot of electrophysiological tests, the ABR, LLR, MLR,
Hmm.
all such things. And
Ma'am, actually,
since you
hmm.
mentioned about SLI and ADHD,
Yes,
uh, though they tend to have normal hearing, they could have some auditory processes being
processing.
affected, say
Yes,
closure or fusing the stimuli or separating the two stimuli, things
yes,
like that. So
like
it can be
that.
easily detected.
So, ma'am, actually, because I meet parents from a variety of backgrounds, and it is normally in private practice, we do not find practitioners who have these tests.
Yeah,
So, say if as therapists we feel that there is a problem that the child should be identified for, or if a parent is aware enough and wants to get a test done, so
yeah,
obviously referring them to Aish in Mysore is one, because I
yeah.
know it's a research institute where all these tests and are available. So do you know any other government body or any other clinics where these tests are done and are done properly?
Yeah, most of the uh, practitioners buy these CDs. Most of these tests are available in the
Okay.
CD form. Yeah. So if
Okay.
they write to the AISH, we have a
Okay.
product development cell, and in the product development cell, we have all the tests developed, all the materials developed as part of research, and it is
Mm-hmm.
sold. So they can use,
Okay.
and they are easy to administer because most of it will have the normative which is given. So you can compare the child's score with the normative and see how deviant it is. And
Okay.
you can,
That's very good information, because say if I am watching this and I am an audiologist and I'm running a center, I think if I can get more tests and help more children and families by
yeah,
purchasing more tests, I think it's very good information.
yeah,
Okay, ma'am. I think we'll move on to our next number two item, which you did touch upon briefly, the causes.
yeah,
You did mention
yeah,
about the peri, the pre, and the postnatal causes, and the acquired causes of hearing loss. But if you
yeah,
can quickly brush through them,
yeah.
what can be some causes and what can be some prevention tips which parents can be careful about, and which therapists as such can also counsel parents
Yeah,
on.
yeah. The first thing is with respect to the conductive hearing loss. The conductive
Yes.
hearing loss is one where your external ear or middle ear would be the cause for the hearing loss. So you
Yes.
can have something from as simple as accumulated wax to a
Yes.
chronic serous otitis media, where you
Media.
have the continuous ear infection and the ear will never get dried. The tympanic membrane becomes perforated. It can become a central perforation, total perforation, so many things. So that could be the cause, or there could be cholesteatomas, foreign bodies, and the children usually have the habit of playing with the stones and beads, and many a times they put such things into the ear, and that could cause some obstruction, and there may be a temporary hearing loss. Most of the time, the conductive
Hmm.
hearing losses are reversible. You can
Yes.
give either medical or surgical treatment and make sure that the hearing returns to normal. But if they have mixed type of hearing loss or sensory neural hearing loss, where it is the involvement of both the external middle and also the inner ear or the cochlea. So that is when it becomes difficult to treat the hearing
The
loss, because
hearing
many of the
loss.
parents will have their concern, like if there is some medicine that can cure the
Hmm.
hearing loss, or if there is
Yes.
some surgery that can correct the hearing to normal. When it is the inner ear, it's very difficult, because no medicines or surgery can cure
Can.
those sensory neural hearing loss. But
Yes.
now there is a hope, because even if the children have profound type of sensory neural hearing loss, with the auditory nerve being intact, those children can be helped with cochlear implantation.
Implants.
And yeah, the cochlear implantation makes them hear like how me and you hear. And
Yes.
that apart, they have to go for a very long auditory verbal therapy, because they need to get trained to hearing with the cochlear implant. So that takes
Yes.
some time for getting them to the environment of sounds, how to associate that sound with an experience, label it, and then understand. So that takes some training, and with that training, they can develop like a normal hearing child, how the normal hearing child develops speech and language. The same way the cochlear implant children can go. And then there is something called the dead ears, dead regions. So the
Yes.
dead regions
Yes.
are the places in cochlea where there is total hearing loss. I may want to touch little briefly about the hair cells in the inner ear. There are two kinds of hair cells. One is the outer hair cell and the other one is the inner hair cell. So the outer hair cell has a function of giving us amplification for the soft sounds. And when certain sounds become very loud, it also has the compression. It compresses the louder sounds to accommodate our dynamic range. So
Yes.
when outer hair cells get damaged, either by the noise or ototoxic drugs, that could cause a problem. So those problems are like the loudness of the sound becoming too unbearable. So that's an
Yes.
indication of outer hair cell damage.
Cell
But in
dysfunction.
certain cases, the audiometric pattern, if you see, the thresholds would be around 90, 100, 110 at particular frequency. That is an indication that there is a dead region. So when
Okay.
the hearing thresholds cross 90 dB and all, the possibility is that at that frequency there is a chance of dead region. The dead
Okay.
regions are nothing but certain frequency regions
Frequencies.
on the basilar membrane have become non-functional. They
Function.
don't get any sound understood by them. So that's a dead region. But the advantage or the good news for such people is that whatever frequencies are dead, whatever regions of frequencies are dead, that could be used by the neighboring frequencies. So there is something called as frequency transposition hearing aids. So once you identify that there is a dead region, the frequencies can be transposed to the octaves
Other.
below or above. So that way
Mm-hmm.
they could be helped with frequency transposition hearing aids. It's a technology that would help people with dead region, whether children or adults. They can
Yes.
have frequency transposition hearing aids.
So such hearing aids are available, like
Yeah,
for
yeah,
masses.
yeah. It's available commercially. A lot of the
Frequency
transposition.
transmission.
Yeah.
Okay, that's very good information. Very nice. And when we talk about prevention of hearing loss, so we did touch on conductive hearing loss. So I'm sure because
Yeah.
most of conductive hearing losses can be prevented.
Yes,
Can
it
it
can
can
be
be?
prevented, it can be treated, it can be surgically operated. But when it
Yes,
comes to the SN loss, I think both
it
ways
is
we can think of some prevention tips.
prevention.
So,
Yes,
yeah.
yes,
So when we think of ear infection as the biggest culprit for conductive hearing losses, so I think many of the people have the habit of swimming.
yes,
So, yeah, swimming is one way of acquiring ear infection. The second
yes.
cause is the upper respiratory infections.
Infections.
And the third
Yes.
cause is the common cold and cough, because the ear
Yes.
and nose and throat are connected. So, if you get a nose infection, it can be easily transferred to the ear. Or if you have a throat infection, it can easily be transmitted to the ear. So,
Yes.
taking good care of one's health in terms of attending to common cold, that would be one prevention. And the second prevention is when you go for swimming, you have to take care that make sure that the swimming pool is clean. The water can enter the ear and it can be the root cause for infection. And the worst habit many people have is when they have a pin, when they have a matchstick, or when they have a pencil, they usually put it in the ear canal. And I think sometimes it is very soothing for the itching and all that. So
Yes,
that's the
yes.
worst habit, because it can cause a damage to the tympanic membrane. So you should prevent people from using the sharp objects into the
It's
ear
in the
to
ears.
prevent the itching. And that's a very simple preventive step. So that
Yes.
could cause uh, the people to be having good, or it can take care of their hearing. And then
Yes.
there are certain infections, like some of the hearing losses are acquired. So if you
Yes.
think of the infections like mumps, measles, typhoid, all those
Yes.
things have to be taken care of, because there are certain vaccination and immunizations that take place which can control all this. So mumps and measles, because if you look at the child's immunization history, there will be all these vaccines that are covered. So there is a what do you say, roster for each of those vaccines to be administered at particular ages, and there are some booster doses. So that would be the ultimate necessity for children, because they should not get infections, and as a consequence of that infection there should be hearing loss. So vaccination and immunization are two important steps. The third step, or the third preventive step, would be to stop exposing ourselves to loud noises. The children have the habit, like now, even if you see a child less than 1 year, the child is all the time with the mobile. Though the child doesn't know how to read, hello.
Hello, yes. There was some technical issue at my end.
Okay. So the
Uh,
other important issue regarding prevention is preventing from acoustic trauma. So I think one of
yes,
the greatest cause of hearing loss would be like when you have Deepavali and a lot of children enjoy bursting crackers, and the more fun is with the highest noise making cracker. So I think
mm,
that should be stopped. And for young adults, they have to stop listening to the earphone while every time I think this mobile, they put the earphone, and I'm sure they hearing it all the time, most of the time when they are awake. So we don't even know what
yes,
volume they are using. So that could be one great cause for high frequency hearing losses in adults. So they should stop doing that. And when it comes to children, I think very important information that I want to convey as a professional is stop marrying the blood relatives, the consanguineous marriages. Many a times, most of our research shows that consanguineous marriages leads to a lot of risks in the child. So they have to stop the consanguineous marriages. And then, all these exposure to X-rays, radiations, and some of the habits like smoking, drinking in the
Yes.
mother, that
Yes.
would also be a cause of hearing loss or some risk that would lead to hearing loss. So
Yes.
that should be stopped.
Yes.
Yeah. Then,
Ma'am, when I used to work in the UK,
yeah,
so we regularly
yeah.
used to have children who used to come and
Uh,
get swim plugs made,
yes, yes.
and it was a
We
very
also make
wonderful.
the,
Yes.
yeah.
Yes. So, but how do you think, is it picking up in India? Do patients come and parents come and get swim plugs
Yeah,
made?
yeah, yeah.
Okay.
Most of the children and adults who go for swimming, they
Swimming
make
regular.
the earplugs in our lab, and
Hmm.
it's made with a comfortable material, something which
Yes.
is soft and nice inside the ear. So
Yes.
that's made, and
So
yeah, they
we
can.
used to
That's a
have
very important.
in, yes. So just sharing an anecdote. So we used
Yeah.
to have children who used to come and choose colors and glitter and
Yes.
marble
Yes.
patterns, and the boys would always go in for blue swim plugs, and the girls would
Yeah.
always like to have
Same thing
glitter
with.
pink ones. So
Yeah.
it's just
Same
an
thing with the
information
hearing aid.
sharing. Yes, ear
Yeah.
molds. Yes, yes,
Yeah,
that's they
because
can
they
choose.
like fancy colors, and sometimes they want something that matches their skin. So you have a
Yes,
light colored
you're right.
earphone. Yeah, this earmuffs plug can be made with different colors. It depends on the material that you choose, the silicone based
Yes,
materials. So you can have different colors and make it appear more cosmetic
yes,
for them. Yeah,
for them. So, ma'am, I have
yeah,
also seen a lot of children who have had grommets fitted in their middle ears, and
yeah,
so do
yeah.
you see patients, children
Yes,
who need
yes, because that's
implant?
one way of making the fluid from the ear is drained out. So a lot
Yes.
of the people who have recurrent middle ear infections, they go
Hmm.
for this. And then there is tympanoplasty, myringotomy, stapedectomy, and most of these surgeries are done in eyes. And I would like to share a good, say, development that has happened. I think earlier the cases were being sent to Krishna Rajendra Hospital in Mysore for ear surgeries. So now Aish is getting its own operation theater.
Okay.
So
Oh,
in the years to
wonderful.
come, yeah, in the years to come, all the ENT surgeons could be
Surgeries.
operating in Aish, and they may also undertake the cochlear implantation surgery.
Oh,
So,
wonderful. That's a great development. And I'm sure because it's so
yeah,
authentic when you are at Aish. You are
yes,
sure as a parent, as a family, that you are being taken care of. So
yeah.
I think that's a very great development. Thank you for sharing
Yeah, we
that
have a
information.
center of excellence coming up building. So in that
Mm-hmm.
building, there is a provision for the operation theater, and our
Mm-hmm.
ENT would take up all these minor and major surgeries with respect
Surgeries.
to the ear, nose, and throat. Yeah,
That's very nice. Okay, now I want to go ahead and talk a bit about. We have touched on types of hearing loss, but we have not really touched upon the effect of hearing loss on speech and language development. So,
yeah,
ma'am, if we can talk about how hearing loss can impact language or separately articulation, the way children speak words and
yeah,
voice and prosody. I think that's also
yeah.
very important for us to know.
Yes, yes. Yeah. So conductive hearing loss, I think by definition is something that is blocking. So when children have
Hmm.
conductive hearing loss, their voice tend to be higher because
Hmm.
of their hearing loss, they will not be able to hear their own feedback. So they tend to use
Yes.
a louder voice. But whereas children with sensory neural hearing loss, their voices will be typical. It is not
Yes.
like how normal hearing children have the voices, because certain of the frequencies they are not able to hear. See, it's very important when we develop speech and language. It's a precursor to have normal hearing. So if you have normal hearing, you will be able to hear all the speech sounds correctly, and you would, whatever you hear, you would produce. So it would be with no error. But when you have hearing loss, it tends to affect by degree and by frequency. So there are regions where certain speech frequencies are low and certain speech frequencies are high. So it depends on what frequencies are affected and whether the degree of hearing loss, is it mild, is it moderate, is it severe, it's profound. So if you observe a profound sensory neural hearing loss child, the articulation, language, voice, prosody, all that is affected to a greater extent. But when you come
Yes.
to the SN losses of lesser severe degree with less involvement of higher and lower frequencies, then the voice tends to be little like normal. But the profound hearing loss children will have all the domains affected. So the sensory neural with severe and moderately severe degrees, the problems are lesser. The conductive
Mm.
loss, it is not a permanent problem. The minute the conductive pathology is treated,
Is
they tend
mm.
to get the normal speech, language, articulation, and prosody. So there is something which would interest every parent. That is the speech banana. So if you look
Yes.
at the speech banana, it represents all the speech sounds of the language. So if all the speech sounds are within the speech banana after the hearing aid is picked, so then the chances are that the child will hear the sounds, speech sounds correctly, and the child can articulate that particular sound, and voice and prosody will not be affected to a greater extent. But only when they cannot hear those frequencies and the thresholds for those frequencies with the hearing aid falls below the speech banana, that is when you have lot of problems in their voice, articulation, and prosody. So I think it should be the type, degree, and the pattern of hearing loss that would affect this. And when we think of short and long term effects with and without treatment, so I would like to say it's important to identify the hearing loss very early. So if we do early identification, the prognosis is very good. And if you want to fit the hearing aid and start intervention very early, then outcomes of that is very good. Yeah, I think there was some technical problem.
Hello.
Hello, Pratiksha. Yeah. Hello. Can you hear me? Hello.
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 Yes, ma'am. Sorry, I got
Yeah.
cut and disconnected again.
It's okay.
So we have a question from Mahnur Mansoor. Were you able
Yeah.
to answer that, ma'am? Can you see it on the screen?
I saw. Do I need to type it or can I say it
No,
again?
you can say it. He has joined us and he should be able to hear your
Yeah.
answer.
Sir Mahnur Mansoor, that is what we were discussing right now. What are the problems of language, articulation, prosody, and voice? So, your question is regarding the prosody and voice of the person who has hearing loss. Because the pitch would be monotonous. They will not be able to perceive the changes that we make in our voice since there is a hearing handicap. So they will not be able to follow that pattern. So that is why they have the voice appears like as if it is only one frequency, monotonous. It is not having changes up and down that we do with our voice. So because of the hearing loss, they are not able to perceive the variations that we do in our voice, in our pitch. So that is why they tend to use only one voice. It appears
Yes.
like as if it is only one frequency that they are able to hear. They are able to produce only that.
Yes. Yes. I hope that's answered your question. Okay. Now I think we have finished the
Causes and
various causes
prevention.
and the types and prevention.
Yeah.
Talking about treatment, if we can know a little more about hearing aids and what's the best to choose and why, and something about cochlear implants.
Yes. Yeah. So hearing aids are nothing but the amplification devices. It's like when we are in a public speech, there are certain public speaking loudspeakers which are used for conveying the speech to a larger population. So the hearing aids work on that principle. There is a microphone, there is an amplifier, and there is a receiver. That's the basic structure of a hearing aid. So the microphone picks up the sounds, the amplifier amplifies it, makes it louder, and the receiver delivers it to the ear of the user. So that's the basic functioning of a hearing aid. But now the technology of digital signal processing has given such advantages to hearing aid technology. You have lot of hearing aids which have digital signal processing. So it is possible to deliver good, clear speech to the hearing impaired. So that's an advantage of digital signal processing. Apart from that, there are certain other technologies which have given the best advantage. They are the noise reduction, because hearing aid is known to make every sound louder. It is not going to make only speech and noise not amplified. It's not like that. It's going to amplify every sound in the environment. So the technology has now advanced, and it has certain algorithms where the noise can be reduced, where the feedback can be managed, and where there is directive or adaptive microphone technologies, so which can make signal get a favored ratio compared to the noise. So all these technologies have helped the hearing impaired to a greater extent, because so many times some of these problems were not possibly addressed with the analog technology. So now with the digital technology, so much advancement has
Can be done.
happened in the hearing aid, and it has accommodated most of the listening demands of the user. So
Hmm.
you can fit any kind of hearing aid, any listening need of the individual, and also have 2 or 3 mics on a hearing aid, so that there is good
The noise
amplification.
cancellation.
So there are
Yes,
different
yes.
types. It can be, I think, as I said earlier, the pocket level or body level type of hearing aids have become obsolete. It's only the
Obsolete.
BTEs, CICs, RICs, and ITCs and ITEs. So the smallest is the completely in the canal, which cannot be seen, but it may not be prescribed for every individual, especially for children and old age people, because this is placed inside the canal. It has to have proper diameter of the canal, because when children are growing, the canal size is changing. So if you fit them a CIC, it has to be replaced number of times, because
Very frequently.
yeah, it becomes small in the ear when they grow. And likewise in the older
Hmm.
population, when they get older, the canal is shrinking, so it becomes small in the canal, so that there is lot of
Yes.
sound leakage. So it is not advised. But the BTE, the RICs, ITEs can fit most of the degrees and sensory neural hearing loss, all degrees of sensory neural hearing loss. You can fit BTE, RIC, and ITE hearing aids, or in the canal hearing aids to a certain
Hearing
extent.
aids.
So I think
Hmm.
to a greater extent, the cosmetic appeal has been uh, overtaken. Like some people would not
Hmm.
want to know others that they are wearing a hearing aid. So if
Yes,
you
yes.
give them the smallest, if the hearing loss is providing for that type of selection, you can go in for that. And now I think, we discussed about the ear molds and the hearing aids having different colors, especially children, they would like to have bright colored ear molds and bright colored body cases for the hearing aids. That's possible. It can be done. And cochlear implantation is one technology where there is the electrodes that are implanted in the cochlea, which will mimic the functioning of our frequency channels in the normal hearing ear. So there are, say, around 22 or 24 electrodes that are implanted, and there are certain candidacy considerations for that. And then it has also a processor, a BT processor or a body level processor with various signal processing technologies for speech enhancement. And the success is very good, but the candidacy is a very strict criteria, because the radiological and audiological findings should say that this person is a good candidate and you can assure some success. So only then it is taken. And AVT is a must, because even if you implant the best cochlear implant and not give auditory verbal therapy, there is nothing to enjoy, because the person, whoever gets the cochlear implant, has to get himself or herself oriented to the sounds and give meaning to the sounds. That is when the success of cochlear implant will be assessed as good. Otherwise, without AVT, if you have the best cochlear implant, it's not going to help anyone. It has to be
Yes.
done with auditory verbal therapy and then frequent mapping, because whatever cochlear implant does is that there is a current level. That current level has to be mapped, the tolerant current level and the uh, unbearable current level. We call it as T and C levels. So those have to be mapped very frequently. Only then, because there are times that some sounds become more loud to you, sometimes some sounds are not heard at all. So it has to be always accommodated within that range of dynamic hearing, because you have to have protection for loud sounds and you have to
Yes.
have amplification for the soft sounds. That is the beauty of our normal cochlea, which I talked about, the outer hair cells. It does that beautiful function. It makes the
Yes.
softer sounds louder,
Louder.
and very loud sounds it compresses and makes it not damage the cochlea. So that mapping is a very, very important follow-up process for the cochlear implantees. And yeah,
Right. Right. So, ma'am, for
hearing
the
aids also.
AVT,
Hmm?
yes, yes.
Yeah,
So,
tell
ma'am,
me.
for the AVT, are there any specific courses that therapists or parents can do to learn more? Have you come across any
Yeah,
short-term courses that somebody
yeah,
can take?
yeah. I think, as I am aware, there is Jaspal Chowdhury in Mumbai. She is a certified AVT therapist, and then our own
Therapist.
Janani is a
Yes.
AVT therapist, and I think they are doing
Yes.
wonderful work, and they can give short-term trainings, and they also
Trainings.
conduct a lot of workshops for
Yes.
making people aware about auditory verbal therapy. They are
Global
doing
therapy.
great job. But there are less number
Yes.
of AVT therapists available in India. So
Yes.
I think
Yes.
with these two trained people, everybody can get help.
Should they should, yes. So, ma'am,
Yes.
according to your experience, is there still a taboo towards cochlear implants? Parents are still opting for hearing aids, or are they okay with the surgery? What has your experience been?
Oh, now at Aish, like I think with the RBSK and ADIP schemes pulling in for poor people's health for cochlear implantation, there is a big demand for cochlear implant. And
Mm.
we have seen that over the last 2 years, there is a steep increase in the number of implantees who
Mm-hmm.
get implanted and come for therapy at ICE.
Mm-hmm.
So we have a dedicated unit called Implantable Hearing Devices Unit, where
Okay.
the candidacy is assessed, where the mapping and initiation of therapy is taken place, and then a lot of follow-up mapping and treatments are available.
Mm-hmm. And ma'am, have you come across any teleaudiology procedures where diagnostics are being conducted through a tele-rehab model, or if therapy for cochlear implantates have been started through a
Yes.
tele-rehab model? If you have any experience or have
I
you
think
come across?
RMC is doing that in Chennai, and
Mm-hmm. Yes.
we have a unit for tele rehab.
Telepractice.
Yeah,
Yes,
it is
yes,
called
yes.
TCPD.
TCPD. Yes.
Yeah, there's a
Yes.
department called TCPD in Aish, and through TCPD, through video conferencing, the diagnostic and rehabilitation services are provided. And Aish has DHLS centers. So these
Yes.
DHLS centers also have children coming for adults, children, and lot of people coming for assessment and rehabilitation. So sometimes video conferencing through Aish, they are getting lot of help. It is possible. And I
Yes.
remember a Fasic who got therapy through TCPD, and yeah, language therapy was delivered through video conferencing. It is
Yes.
possible, and I think we have to develop it more technologically and easily, so that it becomes
Yes.
available to most of the people in the remote
Most
areas. I think that is what should be the focus, because most of the centers are in big cities and
big cities.
yeah, cosmopolitan cities. So the real grassroots level villages will not be benefited by this. So I think if the technology is developed such that where we can have all these, I think one of that would be testing hearing through apps. So I think there are certain
Yes.
apps that are available. Aish also
Coming
has
up.
developed one app such where you can test your hearing
Mm-hmm.
remotely. So that is possible. I think
Yes.
similarly, if the technology is made simple and available, I think we are too good at the satellite technologies
Yes.
and
Yes.
telecommunication now.
Occasions.
So they may come like the patient will sit at home and
Is to share.
yeah, I
So
think
it's
it's a very good move, and I am sure wherever you go, you carry this technology and help a lot
yes.
of society.
Lot.
So
Yes.
I
Yes.
have a lot of
Absolutely.
appreciation for
Absolutely.
your innovative work, Pratiksha.
Thank you so much, ma'am.
Yeah,
Okay, I think now we're coming to the last leg of our discussion today,
yeah,
which is I've titled as expectations. I come across so many families and patients with hearing problems and other speech and language issues due to auditory difficulties. And I think a parent today does not really know what to expect in a long term.
yeah,
So, say I have a child who's been diagnosed with hearing loss, and I've been given this bombarded with this information about cochlear implants and hearing aids and speech therapy and AVT and the regular visits. It's already so overwhelming that
yeah,
we might miss to think a bit in the future. Like, okay,
Yeah,
what is it that I expect out of this? What can be the long term effect of my decisions today? So,
yeah,
ma'am, with your such a long journey and experience with individuals with hearing problems and families, because of whom you deal with, can you let our viewers know what to expect? What can be the outcomes of language development, academic successes, etc.?
yeah,
I think that's a very important thing also to think about.
yeah. When you ask me this question, I go back to 1980s because we have seen so many parents go through trauma. The first word that you say when you say your child is hearing impaired, he will take a long time to develop speech and language, and there is a great responsibility on you. So you see that the parents really have a trauma, and many a times you see that their responses are very alarming. So now, after 20, 25 years, if you see the same parents, the children have excelled so much. So that one counseling which goes a long way. And this counseling is just not saying, oh, your child has this problem, and
Mm.
make that shock to the parents. It's not like that. So there are helps, there is guidance at every step, and it's important that we do a very thorough, intensive counseling. And all this has to be with respect to the realistic expectations, because we cannot give false assurances. So know the problem, know the limitations of the problem, and tell them the importance of team approach, tell them the role of the parents and the environment and the caregivers and professional help at every point. I think it would become a reality for many of the children, because I have seen one profound, say not just one, so many profound hearing loss children who have completed engineering today, who have done post
Wow.
graduation in engineering, and who are working with IBM, Infosys, TCS, and other companies like that. So they are in multinational companies.
Companies.
And
Mm.
I think the success stories of these children have to be made available to all the parents. So then they
Yes.
get their confidence boosted, and their goals, their expectations, their motivations will help them to reach that. So I think the lot of responsibility lies with the professional, because when you counsel them thoroughly about the options of intervention, options of schooling, options of vocations, options of possible team help, and anytime, whatever is their choice, they are ready to discuss with the professionals and have the best guidance available. So uh, one of my child, like, who was a child when I started my profession, today he has finished his master's. He is working in a very great multinational company, Reuters, and
Okay.
he has so many hobbies. He's so tech savvy. He knows everything about the computers. And one
Mm.
more child who came at that age at 1 year, and he's a tennis coach. He goes
Oh,
to
wow.
different countries to play lawn tennis, and he's a big coach, and he worked with Mahesh Bhupati as a coach in
Mm-hmm.
tennis academy, and so many such children are there, so many
Mm-hmm.
such children, and they get their engineering seat through CET, having the competition with other normal children, and they face the class and lab and whatever. And to add on to, recently I went to, like, there is one institute in Mysore which is growing with our institute, and that institute is called as the Rotary Institute for Mother and Deaf Child. I
Okay.
Yeah, I went to their 37th anniversary as chief guest, and I
Okay.
was very proud to see that there is a hearing impaired child who has got into medicine, and he's studying medicine.
Oh,
Yeah, he is
wow.
studying in Mysore Medical College, and what tough competitions he would have undergone to clear
Absolutely.
all those exams and study a tough subject like medicine. And I'm very sure that he is going to be very good doctor who would complete so many post graduations in medicine and become a super specialty. And I'm sure, like, we want to touch upon some other vocations, like there may not be a lawyer, advocate, and CA. So a days will come when we have our hearing impaired children become all professionals in
Yes.
society.
Yes. Very nice. I mean, such success stories are so inspiring, not only for parents, but also for professionals like myself.
Yes,
Every day we have our challenges of working with children, and if we know that if we can guide families today in the correct way, then there
yes,
is so much that they can contribute as citizens to the society
yes.
and
My
be do
second
well for themselves.
I would like to share my second book,
Yes.
which I am planning, is about the success stories. So, which I would
Oh,
bring it,
wonderful.
yeah, so that a lot of parents will know that it's not a limitation when there is a hearing impairment. They can
That is
achieve
wonderful.
anything
That
and
is so
everything.
nice.
Yeah,
That is wonderful. Very nice. I would also like to touch very quickly about people who are deaf or in the deaf community, who don't, who are a parallel branch to what we've, spoken about
yeah,
rehabilitation of hearing loss and taking speech therapy and learning to talk. But there's also another parallel branch of people who are deaf and who use sign language to
yeah,
communicate. And I personally have seen big success stories even in deaf children
yeah.
who grow up and are really able to contribute to the
Yes.
society.
Yeah. So I think this is a very open choice, because when you know that all your oral verbal methods fail, that is the only
Yes,
last resort. But
yes,
that choice should be told at every stage to every parent. So that's when
parent, yes.
you are really helping them, because I remember one of our profoundly deaf individual is in Gallaudet University.
Wow.
He is doing very well. He went to,
In Australia, I believe that's in Australia.
it's in US, Gallaudet.
US, okay.
Yeah, he
Okay,
is in
okay.
Gallaudet. So he is doing very well. And there are
Hmm.
so many people like that. I think
Like that.
if you go to Gallaudet is the only university where sign language is the mode of instruction. And yeah,
Okay.
you have poetry, you have science, you have arts, you have every discipline in sciences that is taught through sign language. And just to make it more appealing, I want to say one of our graduates who became a teacher in ISKCON, he does the discourse of Bhagavad Gita in sign language.
Wow.
He's a normal hearing person. He's my own
Wow.
junior. He's in ISKCON Mumbai, where he does special discourses on Bhagavad Gita in sign language, so that the hearing impaired are helped there.
I
So
can
nothing is impossible. I have a very positive attitude towards life. So when it comes to hearing handicap, I say everything is possible. everything is possible. They can reach everything that gives them graceful living.
So lovely, ma'am. We hope your positivity and good attitude shines through and gets passed on to whomever you meet. And
Yes.
I think this is brought us to the end of our speech hour with you. Although we had a rickety start last time we wanted to host, there were some technical issues, and even today we faced some in between. But I think all is well that ends well.
Yeah.
And I would like to thank you personally for being with us today and sharing mimics of your experiences and your knowledge with us. Any parting thoughts, ma'am? Anything that you would like to close our
Yeah.
discussion with today?
Yeah. So I just want to say early diagnosis, early intervention, intensive training and intensive home training, follow-ups, support from the uh, environment, encouragement from the environment for the all-round development of these children is very, very important. And that is my message to the society. So, whenever you come across, wherever you come across a hearing impaired child or a person, please refer them to the nearest center where they can be helped with diagnosis and rehabilitation. And it's the
Right.
responsibility of every one of us, not only the professionals,
Yes.
each and every one of us.
Responsibility. Absolutely. We have some great response, and um, we thank you again for your time today, ma'am.
Mhm.
I will leave a link of ma'am's website in our comment section. So if you are interested in getting in touch with her, I'm sure ma'am is a very approachable person, even though so senior. If anybody has a question, ma'am, they would probably get in touch with you or leave us a query here, and
Yeah.
we would be
No,
happy to
I would
extend
like to
support.
tell them that they can approach me through my email or
Yes,
my phone number. So I am there to help them with my little knowledge. So I will
that's a very
say
humble thought. Thank you so much once again,
all
ma'am.
the best to all the parents who were watching this, and I'm overwhelmed by your thoughts and your program. So it's been very nice seeing you do this for the society. So I
Thank
congratulate
you.
you, and I would like to see you more often in different forms of success. All
Thank you
the
so
best.
much, ma'am. Thank you
All the
so
best.
much.
Yeah.
Thank you, viewers, for joining Rajalakshmi ma'am today. She was based in Mysore, and thanks for tuning in. We hope to continue the Speech Hour series by bringing in more eminent veterans and guests. Please leave us a reply if you have any specific idea or thought or topic in mind and you would like to connect with somebody in any particular field. Thank you for your time, and it's bye bye for now. Thank you.
Bye,
Bye
Pratiksha.
bye, ma'am. Take care, ma'am.
Bye.
Thank you.
Bye, all the viewers.
Bye bye.
Bye.